For those patients and clinics that are interested in using vitamin IV therapies to assist with persistent post-COVID-19 symptoms, I'd like to share some of my research and share a simple case study. Patient was a 44-year-old female who was originally diagnosed with the B117 variant. Now, after being cleared by public health of the acute stage of her illness, she continued suffering with extreme fatigue, an elevated heart rate or tachycardia, head pain, and nausea. Now, from research that's emerging, it appears that the virus is clearly or adversely affecting multiple organ systems, including, the cardiovascular system, the nervous system, the respiratory system. So patients are having, shortness of breath, heart rate irregularities, fatigue, severe fatigue, and all sorts of neurological symptoms. It also appears that the virus, like other viruses, affects the mitochondria, which are these super important organelles found in every cell of the body that collectively are responsible for your cell's energy. They are the power plant of the energy, or power plant of the cell. The net result is that these patients are presenting with a chronic fatigue type syndrome. So in this particular case, the approach I took was to administer IV nutrients that would support the patient's cardiovascular system, support her immune system, and also to help support her mitochondrial function. I used magnesium and calcium in a 4-to-1 ratio, and I added potassium as well, which I knew would also affect the heart and help it function, as well as the magnesium is also going to affect the mitochondria as well. I used vitamin C in higher concentrations. That's why I used the sterile water, the 250 ml sterile water. I coupled it with dexapanthenol or B5 because I wanted to assist the adrenal glands, which I knew would have been bombarded through this entire process and to affect energy. And then I added acetyl L-carnitine as well as ATP and niacinamide to assist with mitochondrial function. I then added zinc and B6 and selenium to address the immune system, but also to affect the nervous system, as well as a B complex was added to this bag. Now, what was of note was the patient noted almost immediate improvement after completing that first IV. In other words, they were dragging their way into that IV lounge, and then when the IV was completed, they seemed to have responded favorably. And again, within several days, the patient noted further improvement. We've administered 2 additional IVs on this case study, and the patient again continues to show progress. Look, it's clearly too early to tell what we can glean from this particular patient or this particular case study, but because of the lack of resources that are out there for patients suffering with post-COVID symptoms, I thought it was really important that I needed to share some of my findings and also to share what it is that I'm doing here at the office. So stay tuned. I will be posting more results as I get those results. And for doctors or public health officers that are out there that want to know my specific protocols, just contact me. I'll be happy to share them in their entirety. Till next time, stay safe out there and be well.